Almost 16,000 children are in Illinois' foster care system right now. That's according to the Department of Children and Family Services. Some are in foster homes while others are in group homes. Now, experts say it's a system often fraught with instability and sometimes abuse. But now an organization called One Hope United, along with the University of Illinois Chicago, wants to expand on a program that provides a family-style living situation to foster kids aged 13 to 17. They're called Hope Houses. 4 children aged 13 to 17 live in a home at a time. They each have their own room. In addition to 2 full-time house parents who are One Hope staffers, there's also a full-time therapist and youth care worker, in addition to a part-time nurse to help them navigate their future and work through their trauma. One man, Woodson, says he spent years in group homes before entering Hope House at age 16.
At Hope House, it felt more personal and supportive compared to other placements that I've been through. It didn't feel like we were just in a group home facility. It felt like we were more in I would say more like a caring environment, because we had house parents and stuff like that. And then they did they spent we would only have one house parent, and they spent almost the whole day with us. And then we had youth care workers and stuff, so it helped.
How did that change your life?
It gave me more structure, and it showed me the importance of discipline and consistency.
Joining me now to talk more about this are One Hope United CEO Damon Cates and UIC's Dr. Jennifer Geiger. Thanks so much for being here.
Our pleasure.
So Damon, I know there are already 4 Hope Houses in Illinois, 2 in Rockford, 2 in Champaign. Why partner with UIC now, and what is the goal?
So we started our first Hope Houses actually in Florida 7 years ago, and we're up to 11 of them there. And then now, as you mentioned, we have 4 of them in Illinois. And as we continue to expand, we know anecdotally that they're working really well. We see stories like Woodson's and others where we see the impact and the progress that they're making and the things that are happening positively in their lives. But we also wanted to partner with Dr. Geiger and UIC to fully understand what's going well, and then where there's some opportunities that we can continue to refine and improve the model.
So Dr. Geiger, what will UIC researchers be analyzing? What data are you looking for, and how will that be used collaboratively moving forward?
Yeah, at UIC, we're committed to doing community-engaged research, and we're really excited to partner with One Hope United and their Hope Houses, because this is a unique situation, a unique placement option for youth in care. And we're going to be looking at a lot of different things. We're looking at stability in terms of placement. We're also looking at mental health outcomes and relational permanency options for these young people. So a lot of different things in terms of outcomes for youth, but also we're trying to understand this model itself so that we can establish a more structured framework that can be applied in different states and different areas.
Yeah, all to try to help give these kids, a better quality life, if you will, more stability. Now, Damon, I understand you've already found that Hope House residents are 5 times less likely to run away than their peers who are in traditional foster placements. What other positives have you seen, and are those differences, why are they so important?
Yeah, there are a couple major ones. One, we see that there's much more participation not only in school, but in also co-curricular activities for the first time because of the stability that they have, the consistency, the routine. Youth are more apt to not only be successful in school, but then to do other things outside of the school environment. Also, less than 3% nationally of youth in foster care get their driver's license, and over 50% of our youth who are eligible, they're old enough to get their driver's license, do indeed get their driver's license. So we're seeing some really positive impacts from the Hope House stability and routine and consistency.
So I know data-driven, of course, but also programs like this, I would imagine, also take money.
Right.
So either one of you, I'm going to throw this out there, to move forward successfully and build more Hope Houses, how do you pay for that?
Well, in Illinois, I'd like to give a special shout out to Heidi Miller, who is the director of the Illinois Department of Children and Family Services. She's been a true champion. I talked to her early in her tenure about the Hope House model, and she's helped champion that across the state. And there is funding for it, but the funding that we receive covers the costs. We also fundraise from private donors to help, what we like to say, make the house a home, because there are also lots of expenses that come with
Right, of
running
course,
a home.
of course.
And donors and philanthropists help us with that.
Right, right. Well, Damon Cates, Dr. Jennifer Geiger, thanks so much for joining me this morning to talk about this. Please keep us posted on your collaboration, and as things move forward, I would really like to stay on top of that because I think it's so important.
Well, thank you for having us.
Thank you.
Thank you.